Hello everyone. Welcome to Dental Digest with the Study Boards. In today's episode, we will cover viral infections, especially those viral infections that have been tested in the exam. And it's an important topic when we are talking about oral pathology. So today we will be talking about measles. In today's video, we will be exploring some key aspects related to measles, including how it is transmitted, its clinical features, oral manifestations, complications, and methods of prevention and the treatment. Now, measles is also known as rubeola, which is caused by measles virus, which belongs to paramyxovirus family, which is an RNA virus, and it spreads through respiratory droplets whenever any infected person coughs or sneezes. This is an exam question. And our next thing that you need to remember is that for how long it can stay in the air or on the surfaces. And the answer is it is going to stay there for almost 2 hours. And this is what makes it highly contagious. Measles typically starts with symptoms that resemble cold or flu. You can also have high fever, cough, runny nose, and red watery eyes. Now, these early signs last for about 3 days, and then a unique feature appears, that is Koplik spots. Now, these are small white spots that develop inside the mouth, providing an early clue of the measles infection. Following this, the classic red blotchy rash appears. And this usually starts on the face and then it spreads downwards to cover the rest of the body. And this distinctive rash is a hallmark of measles, which helps you to differentiate it from other infections. Now, as dentists, it's important for you to recognize the oral signs of measles because these can be key for early diagnosis. And the hallmark feature is going to be your Koplik spots. These are small, white, bluish spots with a red halo, which is often described as looking like tiny grains of sands on the buccal mucosa, typically appearing near the molars. Now, Koplik spots may also appear on other parts of the oral mucosa, such as inner lips and the throat. Now, in addition, other oral symptoms may also be present, including erythema, like redness in the oral tissues, and then there could also be ulcers that can develop as the infection progresses. Now, notably, Koplik spots often emerge before the characteristic skin rash, making them an early indicator of measles and especially valuable for your clinical diagnosis. Now, while most people recover from measles, the infection can lead to some serious complications, particularly in young children or in those individuals who are immunocompromised. Now, amongst the common complications are otitis media, which is an ear infection that can even result in hearing loss. And the second one that I want you guys to remember is bronchopneumonia, which is a severe lung infection. Now, measles can also lead to laryngotracheobronchitis, or you can say croup, causing breathing difficulties. And in rare but severe cases, measles can also progress to encephalitis, which is the inflammation of brain that can result in long-term neurological damage. Now, very important thing to remember is that even after initial recovery, there are some individuals who may even develop a fatal brain disorder called as subacute sclerosing panencephalitis or SSPE. Now, these risks really underline the importance of vaccination, which is a crucial measure in preventing these potentially life-threatening complications. Now, let's talk about the prevention, which is really straightforward because we have the vaccination for it. Now, the measles vaccine is usually administered as a part of MMR vaccine, which also protects against mumps and rubella. Now, this vaccine is highly effective, with 2 doses providing immunity to about 97% of those who are vaccinated. Now, the MMR vaccine is administered in 2 doses. The first dose is given between 12 to 15 months of age, and the second dose is normally administered between 4 and 6 years, often before starting the school. Now, in some cases, the second dose can be given earlier, as long as it is at least 28 days after the first dose. And this 2-dose schedule ensures high level of immunity, helping to significantly reduce the measles cases worldwide. Now you must be wondering if there is any specific antiviral treatment available for measles or not, and the answer is no. Because of this, the focus is mostly on symptomatic relief and supportive care. That's why these patients are encouraged to rest properly, stay hydrated, and use antipyretics as needed to manage discomfort. Now let's summarize. What have been the key points on measles? So first of all, we know that it's a highly contagious viral infection, particularly belonging to paramyxovirus family, and it's an RNA virus. And then it can pose serious health risks, especially if left untreated. Then measles has recognizable signs including Koplik spots and a characteristic red rash, which helps in early diagnosis. Then we talked about some potential complications ranging from respiratory infections to severe neurological damage, such as encephalitis. Then we talked about the vaccine protection, that is MMR vaccine, which is highly effective method of prevention and providing immunity to individuals and contributing to herd immunity. Last but not the least, the most important question that is asked is regarding the dosages. So remember, we give two dosages and both the age groups are important. They might ask you that if a patient has been given a vaccination, what could be the minimum day difference between both the vaccines? And the answer is going to be they have to be minimum 28 days apart. Thank you so much for watching this video. Now, if you enjoyed the video, don't forget to hit that like button and subscribe to the channel for more content. Remember to keep working hard and keep rocking. I'll see you in the next one.